welcome. Welcome, Lynn. So
Hi,
happy you're here.
good morning, everyone. Um, do we get started now, Deb?
Yes. I'm gonna just keep letting people in as they come in. Thank you all for being here and being on time. I'm so excited to share with you Dr. Lynn Taylor. She is a licensed acupuncturist in Northern California, an amazing perinatal pelvic floor acupuncturist, and she's going to share some of her gems with us today. So without further ado, Lynn, you want to take it away?
Yes. Hi, everyone. Right now, I see all of your screen, but I won't be able to see your question. But please feel free to type your question in the chat, and we will address them at the end. Is that okay, Deb? Yeah. Yeah, and but however, we're gonna have a live presentation, live demo today. I have a patient of mine I have seen two times. I've seen two times for urinary incontinence, and she's very open, and we can ask her question. So you kind of see real life. Like I actually tell her, don't tell me anything, so I don't know what I'm gonna encounter yet. Overall, she said she's doing okay. Right, Karen? So it's Karen gonna be with us today. Okay. I am gonna get started. Hi everyone. Okay, here you go. Hope you see okay. I'm an acupuncturist in San Jose. I started out with pain, orthopedics like most of us in school. But somehow, as patient get to know me better, and trusting me, you know how it is like a year later after they meet you and they're like, I have this one issues. I don't think any acupuncture can do anything about it. But I just want to share. Like if it's just like, um, well, hoping maybe I'll refer them, maybe we'll find a way. And then that's how I get into pelvic floor acupuncture. I'm also work with Indian Health Center. I work with resident at Stanford residency program. So I started out with a resident. Now all the residents know what acupuncture can do, and they super happy to have an acupuncturist in house, and they super happy to know that they can refer patient to acupuncture. I still get questioned all the time, like, can acupuncture help with sciatica? And as an acupuncturist, we like that's what we do, right? And now they are very surprised like acupuncture can help with pelvic floor, pain during sex, urinary incontinence, postpartum during menopause. Um, so sometimes you do have to spread the word that what we can do and educate your current patient because once they know, or for example, I'll tell them, "Hi, I went to this training over the weekend, to kind of learn more about pelvic floor." They say, "What? Acupuncture can do that." So conversation like that can really get you starting into the pelvic floor area. Okay. Um, I'm currently treating around 70, sometimes up to 90 patients a week. I work about 4.5 days a week. And seeing a lot of patients would mean you gotta have to be comfortable in addition to learning pelvic floor, learning how to communicate. Like for example, when I work with Stanford, every patient have 10 minutes with me and I do have to treat their pain in addition to anything coming up like IBS, pelvic floor, very short time. So the more patient you can see, maybe start working with someone, maybe doing volunteer, see as many body as possible so you know where the body part is and what to expect when you go either down there or different area of the body that you never seen before. I'm gonna get started into the content. And go ahead and do you have any questions so far? You can actually turn your microphone on and ask if you have any question. Okay. Um, so when we talk about urinary incontinence, when we interview the patient, it's exactly the same. Like what you would do with a typical patient. We're going to, do you remember in school, we talk about the 10 asking songs? We'll ask about patient whether they run hot, they run cold, because sometimes when they feel a cold weather, especially winter, make people want to feel like they're gonna pee more, correct? Yeah. Like when it goes someone cold, right? It's just like, oh, I gotta go. Sometimes it's the sensation, right? And you all know. So it's good to know that whether they hot or cold, because in addition to even acupuncture, dry needling, manual therapy, a change in diet may be helpful, right? Having warm water with them as they go shopping, as the winter, that may be helpful. And their sleep is important as well, right? Bowel movement, urination, headache, pain, women health. Are they still have their menstrual cycle? Are they regular? How much pain they in? Especially women health question. If you know they have existing endometriosis, if you know they have cyst, if you know they have constipation, bloating, all of that matter. And mental health as well when we treat those area. How much they exercise, what type of exercise does matter. For example, someone postpartum, a lot of loading right below their knee, like if they do weightlifting, that does make the middle child, the pelvic floor weaker. However, if they do it appropriately, like work with a personal trainer or work with a physical therapist to strengthening, then that may be okay. However, with the urinary incontinence, it could be the pelvic floor too weak or too tight. But often I find that it's a mixture of both. Some muscle is not activate properly, and some, is atrophy from like 9 months of carrying a baby. Some muscle is too loose, some muscle is too tight. Um, Usually be best if like, have you seen your OBGYN? Do you have a pelvic floor physical therapist? Because that what they go in and we check the muscle to see how it reacts to different stimuli or even palpation, like what we would palpate outside. I do both internal, and I do have my scope of practice allow me to do internal and external as well, external and internal as well. And diets matter as well, right? Certain food that make you feel more like you're gonna urinate more. Stress the matter because there one thing called like stress urinary incontinence. I have patients, they feel more like they need to pee when they're in the environment that feels stressful, or they have really a lot of stress that day. One of my patients feel more like he need to urinate when he in an elevator with people around. Um, so, so knowing the root cause of urinary incontinence matter, but at the end of the day, you do want to make sure all the muscles surrounding the pelvic floor, surrounding the bladder is nice and loose, right? Um, Urination. So I'll go back. Usually, like the postpartum patient, when you have like urinary incontinence, you find that they might leak when they sneeze, when they cough, right? So those are usually when we treat the lower abdomen and the inner thigh is what our focus gonna be in. Go to the next slide. Um, So, for example, I'm gonna start palpate my bodies right here. So if I press here, very unlikely it's gonna make me wanna pee, right? So you can actually test your patient to see what muscle do you need to do an ashi point on, like palpate them. Start with the upper abdomen, right? It's like they feel fine. And then we go down, okay, even on yourself, say, oh, when I press on this muscle, I feel like it makes me want to pee, right? because it does pulling on the bladder. So simple as that. You don't even need to know the name of the muscle you're going through, and you press. That's fine up there, right, Karen? But when you go below your belly button, it make you feel like I gotta pee, and I know she already went to the restroom. Simple like that. And how about your inner thigh? Like around your knee is fine, but really close, right? So now simple like that, even if you don't know the name of the muscle, even if you don't know, but relax these muscles. So when they so what happened to cough and sneeze, that's when your abdominal muscle drawing in, so that increase the intra pressure coming down toward the bladder. So that's why it makes people feel like they're gonna pee, right? Or if they have any urine in their bladder at all, they're gonna feel like it's gonna come out. So by relaxing the muscle is really help for both postpartum patient. I do see quite a few elderly who come in because they get to the point that they can't sleep through the night. They wake up 3 to 5 times at night. And my rule of thumb is around, 60, 70. If you wake up one time, it's very common. I'm like, that's okay. They go back to sleep. But if more than that, we can actually reduce them to one or nothing at all. And some condition to look out for is somebody have diabetes, right? So diabetes is they have the vasal like in diabetes patient and also autism, which is my older daughter, they don't have the ability to make a huge amount of vasopressin. It's one of some of the hormone that reduce the ability of the kidney to make less urine, especially at night. So that is when acupuncture is traditional acupuncture is so helpful because we can help with diabetes, because we can help with the nervous system, right? So when we're doing the acupuncture point just for relaxation, for neuromodulation is help. Like all the points that have the water name in them, you can use. Like and our favorite point, spleen 6, right? Kidney 3, right? So think of it like something jump and it make me scared. I want to pee my pants. Like that kidney 3 right there, the fear, right? There is one trial at Stanford. They actually use kidney 3 and spleen 6 point with electrical stimulation, and that help with urination. They charge like more than $10,000 per patient. It's a lot of money, and it's very successful. And right now, physical therapists also do those as well. So they call TPA, um, TPA stimulation. So there is the urinary reflux. The sacral reflux is at your kidney 3 and spleen 6. You're gonna do spleen 6 like in Richard Tan kind of spleen 6, a little closer to the bone than our typical spleen 6. So make sure you find spleen 6 and then go closer to the bone. So that is very helpful. And all the point on the UB channel, especially UB 33. You're gonna have a slide coming up. We go over that. UB 33 and 35 would be helpful as well. Okay, so let's go. Let me skip this slide. It's a case study here. Let me jump into it. We're talking about acupuncture already. Okay. Can you see the screen okay, Deb? So for acupuncture, with acupuncture with electrical stimulation is definitely more helpful than just acupuncture alone. But if you don't have eStim with you, just as good. Because when I work at Stanford, I'm actually don't have an eStim unit. I just don't have enough time to even set patient up and plug it in. So I've just been doing acupuncture and that's work okay. So there a sacral neuromodulation. So you regulate the maturation reflex of urination reflex right on. So on the sacrum, on the body. Let me see. Do I model? Hold on a second. I'll go right up. model so I can show you. So, be right back. Hi everyone. I'm back. Hopefully you can see this, right? So this is someone back here. Can you see that?
Not really. It's because it's only you, your face or your body, so it's kind of
Oh,
distorting.
it doesn't show the model, huh? How,
It's kind of just partially showing. We have pictures on the screen. I don't know if you can
oh,
point
okay.
to the picture.
Yeah,
Maybe that could be
I
helpful.
do have a picture. Let me find a picture on the screen. Oh yeah, that picture on the screen on the third side that you see. So you it's on the back. You're gonna find the PSIS, the dimple that some patient have. So that the PSIS, and you coming down. You're gonna trying to find every sacrum. You're gonna have four hole on each side. That the sacral foramen. So you're gonna find the third one and the fourth one. And the fourth one happen to have right next to the coccyx. So if you don't know how to find the fourth one, sometimes the hole is harder to feel. So you're gonna go down and you're gonna find the coccyx. And from the coccyx, you just jump over few millimeters. So that is also on part of the coccygeus. Someone with tailbone pain, this would be useful as well. So no point putting on UB, all the UB from the first foramen all the way to the fourth one. They are useful for urination. So if you have a patient already have low back pain and they have frequent urination, this would be a good one to do. Our postpartum patient often already have low back pain from carrying the baby and from bend over and breastfeeding. So if you're gonna have a treatment of face down, this would be the best thing to do, right? You're gonna do maybe UB33 and then add in UB33 or 23 and add in UB33 and 35. Okay. Um, and with the leg, you can prop the leg on the pillow, so that allow you to get to kidney 3 as well if you like to do that, and splint 6. So that's pretty good. That's pretty good and solid treatment to do when they have the backside, especially our elderly population. That would be good for them, good for their low back pain, good if their arthritis, and help them not to wake up at night. So what happened is even your regular pain patient, but if they have to wake up, if they're young, they have to wake up every night, it's gonna make it very difficult for them to recover from the pain, because sleep is when our body completely relax, right? That is our physical recovery time right there. That's why patient who doesn't have good sleep, they might be a harder recovering from their exercise, recovering from an injury. So for my treatment, regardless what the condition, I always help patient with sleep and stress. That's always the add-on. So a patient facing up, point I like to do is lower abdomen. Um, so you remember in school, the teachers, I make sure the patient go pee before we do the point. I'm showing here on the middle pictures. So where you have right on the bone, that is REN2, right? REN2 right on top of the pupil symphysis. So pupil symphysis is one of the I would do urination as well. So you can do REN2, you can do an Ashi point on the pupil symphysis. And then you can see that that point is actually pretty safe to do. Like the intestine is out of your way, right? All the intestine up above, and then you hit the bladder. And then just that whole area, I mean, you're going slowly, nerve and vein, everywhere. But if you go in slowly, hey, I always check in with patient. You feeling okay? Yes, yeah. Okay, so the bladder there, make sure the patient go urinate before the treatment. Just in overall, make sure they urinate before your treatment so they comfortable laying down for 30 to 45 minutes. Yeah, so that going straight in with Ren 2 and jumping over stomach 30 is an important point as well, only because it on the pure medalis is one of the muscle that can also affect and being very tight during pregnancy. So as you can do Ashipoi, stomach 36 in general is not an in the inguinal ligament is above that, like above the groin. So that's a very safe area to do. I would point the needle toward direction of Ren 2 toward direction of pupil symphysis if you can. So that can be an acupoint. Um, you're gonna get into the area, and when I have a model, I'm gonna show you, how I'm gonna palpate, and the direction of needle could be point toward Ren 2, could point toward pupil symphysis. If you're not comfortable, you could just do a needle in and then remove the needle and let the patient just rest with Ren 2. Okay. So usually, I would put the patient in Ren 2, acupoint pupil symphysis, stomach 30. Might even do stomach 25 as well. Since the rectus abdominis go all the way down into toward the pelvic floor. Okay, so that for acupuncture. Gonna next to the dry needling. So for dry needling, some of the muscle that I feel like the most bang for your buck is the adductor. So if I have a urination patient and they not like needle and there only one thing I can do, if I have to pick one thing only, or this patient come to me not for urination, but I want to help them now because their pain is so significant. If they don't sleep and they have to wake up several times a night for their neck and shoulder pain, they not gonna get better, even if my treatment is like, already good. So if I have to pick one out of everything, acupuncture, needle, everything, I would pick the adductor. The adductor is the inner thigh muscle. So it go from the groin, you go all the way down to the leg and the knee. The adductor muscle in the inner thigh, go back like here, the adductor muscle. I'm not sure you can see the point right here. So it go from the groin area come down to the knee. Adductor muscle also help with the knee pain from the inside as well, the medial side, the knee pain. So I would work on their adductor. And how do you do that? Adductor, you come in and you can come out. So you can see the middle pictures right there when I do the adductor for a patient of mine. So I'm gonna check on the adductor. You want to find a trigger point or a local point right in the upper top middle, like upper top of the thigh, not the lower one, unless you do the knee, right? Upper top, usually very close to the groin area. You might find that it's like how you ask patients like how you feel. A or B, do you feel more here? So your job right here is coming in and we'll find where we find the most tightness on the patient. And I'm gonna demo that on my patient as well. And you can see on the first picture as well, I'll show in the pure medalis, also stomach 30. So you can see how I gather all that flesh. I'm finding that trigger point and I'm going toward the patient pubic bone. So at the angle, we'll show that on when we have a patient as well. So you go in, you come out. Yeah. So that adductor pure medalis is your stomach 30. Pubic symphysis is the vertical area right at the junction of your pubic bone, and then come down like that. Okay. Pure medalis and pubic symphysis also helpful in outpatient with pain during sex and endometriosis. Come into manual therapy, very similar. You're gonna go in, you apply pressure and compression into this area, pretty much just pressing down. Um, Especially my hand is small. Often I can't really hold on the muscle. You're pressing down and just have the patient breathe. Pressing down on the adductor, pressing down on the pupil symphysis, and then pure medalis as well as iliacus and psoas. So I'll show you so on the pictures right here, you can see iliacus is the lining muscle of the pelvic bone right there. And then the psoas is connect from your lower back about UB23. Yeah, it's on L2, and it come out onto the iliopsoas, your hip flexor. So that is the muscle. Often with someone with endometriosis, with someone have low back pain, and also adding in urination issues, that is those two muscle, psoas and iliacus, that we want to work on. You're gonna see more in detail when we demo on a patient. Here you go. Before we go into the patient, I'll show you real quick what a patient look like. This is the patient I just saw 2 weeks ago. Usually patient would come in and this is their complaint. This patient have severe pain. She originally had to wait about 2, 3 months to see me, and she texted me one day. She said, "I'm in so much pain. I'm already see a physical therapist, and my doctor, there's nothing they can do for her. They already have Botox injection. They jacked and they couldn't find anything wrong with her." And as we know, like even pressing on the muscle make you want to pee. So that is the one area that MD and other specialists they not specialize in. We are the one that in charge of the muscle, right? Um, any other profession, pretty much even PT, getting real into movement, except with pelvic floor PT, they do manual work. They do fascia relief, which we're gonna do soon too. And it is our scope of practice as an acupuncturist. You can do manual therapy. You can bill for manual therapy. Even sometimes we bill for the code 9710140. We built it as cupping, but we actually don't have to do cupping. We can do actually manual palpation, deep palpation, even gentle palpation, or even lengthening someone back, right, with trainer, and that can be billed as manual therapy. So you can see this patient right here. When she have the worst pain, is just really high up there. And currently, this is the report. That is before she even come see me. She texted me. That's when she said it's constantly for the past few days is up the top 8 to 10. So I'll have her in actually that minute. You can see that movement make it better, heat make it better. So for pelvic floor, if you can have infrared light therapy on top of the needle, that would be great for the patient. I'm gonna show to the next one. And then she already seen even a chiropractor, she see a physical therapist, and you can see this patient here too. In addition to the pelvic floor pain, she also have neck and shoulder, abdomen, lower back, hip, front and back, and leg and foot. Her pain all over. She actually have never have a baby. She planning to have um, to get pregnant the end of the year. So this is a big fear for her because it's like I never get pregnant. I already have urinary incontinence. I already have pelvic floor pain. What's gonna happen to me if I'm actually gonna have a baby? Patient also have TMJ pain. There is a recent research, if you see, there is a connection between TMJ and pelvic floor pain. And they like all the muscle down here does affect the pain, right? It's our neck, it's our lung channel, it's our breathing. It does go to, I mean, lung channel is when we see the point, it come out of the hand, but the actual channel and energy itself, you know that we go into all three channel, right? All the way to the abdomen. So for TMJ patient too, um, that's another, if I see this on my report, like TMJ pain, when I treat pelvic floor pain, I would end the day with actually some point for the TMJ as well, because that may be the cause of the pelvic pain. Or it's gonna help on the nervous system level. So that's something to look in. And ringing in the ear. This patient is 39 years old. She's very young for ringing in the ear. So now, what are you we thinking, right? There is some kidney maybe involved, right? Because she didn't have any incident, no accident. So that is like, okay, that kidney involved. Maybe kidney 3 would be good for this patient. Yeah. And she also have brain fog, fatigue, worry, low sex drive. She have anxiety as well. So you can see that maybe with this patient, in addition to treating the muscle, right, the local point, she does could use traditional acupuncture. She could be relax the nervous system. This patient definitely can be helped with sleep. Um, and any point you can think of for stress, like yin tong, an mian, right? Peaceful sleep. That would be good for this patient. Right? So usually even before you see the patient, gonna we might want to have a pictures who they are before they coming in. Like you already have a plan, right? Maybe I don't know how much they like needle, but I'm gonna plan some, right? If it's the only needle she allowed me to do, is kidney 3. That's great. Maybe I'll do kidney 3 on one leg and splint 6 on the other leg. Because you don't want to, if someone worry of needle, you don't want to do double on each side. So it still work. One on each side. And then now it's her chief complaint is pelvic floor. If I have to pick one, especially urinary incontinence, I would do the adductor, the inner thigh, right? Find a big knot in the inner thigh, you in and you out, and then take it out. So patient can relax and maybe splint 6, kidney 3, some yin tongs, very gentle, and can call it a day. And believe it or not, 3 needle patient do feel better. It's happened all the time. I know sometimes it's really hard to believe that acupuncture work, and I know when you just start out in school and trying to gain patience, it's really hard to believe sometimes that it work. And I was like, oh my gosh. But there one research found that even PT teach this, the most powerful medicine is placebo. And that when you coming in, even have a doctor believe in you, it's like, I heard you. Yes, I don't think it's in your head. Because a lot of time when stress, anxiety that cause urination, doctor would just say, hey, I'll give you, medication and it's gonna help better. But that is very dismissive for some patient. They're like, so it's all in my head. It's part of it, right? I mean, if I have to pee all the time, if I have to wake up, I will have anxiety too. So we don't know chicken or egg, but just hear someone and go and palpate them and do like, okay, this muscle is tight. This is your lower abdomen. And when we cough, this muscle have been contract and it pushed out the urine. So it's tight. Let's take care of that. Just to hear that, oh my God, you find something in me that it's not just my imagination. It's really help patient feel better. You believe in them that, hey, I can see why you have this. I can help. And just by saying, hey, I can help you, they found that like you already make them feel better. They already feel more at peace. And they already feel that they can sleep better at night when it just have someone to talk to, someone believe in you, someone's even just a promise, hey, I can make you feel better. It's already make people feel better. And I think that's why acupuncturists doing such a good job because we are willing to be in the room and listen to the most crazy story, right? Because their doctor just like, oh my gosh, this is a lot, right? They come out and it's like, oh, I have to give her because they want something quick instead of like, let's look into maybe her pelvic floor is not her, maybe it's her relationship, maybe her sorry. I love my mom, but maybe your mom in town. It calls me, oh, like I love my mom, but I wouldn't be able to in a room that not bring up all sort of emotion. If she stayed more than a month, I'm like out of my mind. But that, in their relationship too, their husband, their sex life, everything. So that's where we shine, that we have the patience to sit and listen, to understand them, to hear their story, and to willing to go and like, let me palpate your abdomen, let me palpate this point, and to being even provide a treatment that they have never had before, right? It's very helpful. So um, yeah. Right. So this patient also have bloating, gas, acid reflux, hemorrhoid. What are we saying? Like their middle jaws definitely need work, right? And their hemorrhoid and constipation. Now you think about their the middle jaw also not strong and need lifted. So if you into herbal medicine, like you think about, she haven't ever give birth, she not anemic. So this lifting and driving the cheese up definitely useful, right? If this the point, do 20 always works really well, especially with brain fog, like yin tong do 20. Like I haven't seen her. I was like, let me do, these are other options. And when you work on the pelvic floor too, the constipation gonna be helped. Remember, we talked about doing UB 35, where the coccyx are. That perfect for constipation too. And we do tell patients, I say, hey, at this point, and it's gonna help with the reflex of urination. It help with getting into the nerve here, and also it help relaxing your coccyx, would help open up, so you're going to have less constipation, and UB23 as well, right? And also kidney 3, splint 6 also help with constipation because of that. So just like have a plan before you see patient, so you can make a better decision, and you can have a goal of how many treatment that you need, right? So she also had pelvic pain. She also had pain during intercourse. And again, we talk about the lower abdomen, the piriformis, the stomach 30, the pelvic symphysis, all of that gonna help with pelvic pain. Her urination is frequent, incontinence. She a weak stream. So that's, you can see that weak stream. That where we most helpful to doing abdominal muscle, lower abdominal. That's gonna help with the muscle being stronger. So in general, when the muscle already contract and tight, like my arm right here, I don't have a lot of force. But if I'm all the way here, I can generate a lot more force. So think of muscle like that. Just because it's tight and big doesn't mean it's strong. It just over you and it's short, and it doesn't have the ability to generate as much force. So we want the muscle to be able to lengthen and able to contract. So that's why all the football players do yoga, right? So we can explain to patient that just because it's big doesn't mean that it's strong. Just because you have six-pack muscle doesn't mean you have strong core. Just mean your muscle is condensed altogether. So when we able to lengthen the muscle, then you can contract better. When we able to lengthen the muscle on the low abdomen, when the menstrual cycle come, right? All the cramp and contraction gonna cause so much pain. But if the muscle are nice and relaxed, they're slack to go. So the contraction not gonna be as bad. The contraction doesn't make them feel like they have to take pain medication. Um, so all of your work here on the lower abdomen, not we trying to help patients with urinary incontinence, but this can be applied to any pelvic floor, endometriosis, PCOS, painful during sex, pain after eating, pain after surgery or C-section. All of this can be helpful. Um, so you can see that patient actually waking up to urinate more than 4 times a night. Can you imagine? That's a lot. So after I seen her 2 times, after the first treatment, she actually only wake up 1 time a night. And that's all I did. What I told you, I actually just did the adductor. I did the pupil symphysis, stomach 30, REN 2, and stomach 25. That's it. That's all I did. And then I didn't even do electrical stimulation because I didn't have time. Yeah. Okay. And you can see that this patient also already seen another acupuncturist, and they gave her 焦维逍遥散. So, like you can see that there's this practitioner trying to, free the G, move the G for the patient. But at the same time, like you can see, there's somebody already in the work, but it's not working yet for her because maybe that's what we're trying to do, right? More local. She said that the acupuncturist actually never treating her abdomen or her back. Like she actually never take off her clothes. They just give her herbal medicine and then some poi, some distal poi. So it's good that we go in there and we make sure we check to see if they have any tightness in the muscle and we just relax it. Okay. Okay, so let's jump in. Let's do a demo. Yeah. Okay. Hi, everyone. Jeff, you be okay? We're gonna go to a demo. I'm gonna turn off the share. Okay, so Karen gonna go to the restroom real quick before we do a treatment. So we have a few minutes here. If anyone have a question, go ahead. Do we have any question, Deb, on the chat? I'm gonna stop sharing.
No, I don't see any questions, but anybody's welcome to chime in with some.
Yeah.
That is, how frequently do you find your patients take herbs? Somebody asks.
Um, so far, actually, the patient come to me, um, they haven't taken any herbs, actually. There are only one or two, so I'm surprised. The patient I just show you, she actually seen someone who already very well known in pelvic floor, and she got dry needling already too. So that's what I think it missing some of our provider who does only dry needling is the traditional acupuncture. I really think, that's where we started out, right? And it worked well. So I would not recommend to abandon what you learn because traditional acupuncture is where we regulate our nervous system. How as great as dry needling is, it's the local, it's the ashy point.
So Sandra asks, could you give us an idea of how many treatments you would recommend based on patient severity?
Yes. So this usually this patient, what you just saw, it have a lot of things going on. That's not just pelvic floor. Like, do you agree? So for her, right, their brain fog going on, their pain all over the body going on. So if it's just the pelvic floor alone, sorry, just a urination alone, I would say 2 treatment, right? Because we already proved that, like after the first treatment, she only instead of peeing 4 times a night. Is only 1 time, and that is a win already because now you can see she sleep better. She texts me the next she text me the next day. She says, "Oh my God, I only wake up one," and I check in with her a week later. So when you start pelvic floor, do check in with your patient a week later. And she said, some night I wake up, some night I don't. But if she wake up, it's only one. So that is already continue to be better. She also continue seeing her PT, which is very helpful for us, to work with other provider, so we get a bigger impact. For other condition, neck, shoulder. So I would say the urination issues only 2 visit. The other issues, I would say we're gonna get her to the point that she just need to do stretches and she feel better. Um, I would say about another 6 visits for the rest of her condition, and after that, she does have to come back every few months.
Okay.
Um,
Thank you.
Yes, because we don't know how she's gonna recover from other condition until we treat her, and that's how usually it is. I tell patient, I know better when I know how you respond to the first treatment. So let's say we're gonna target her, because if we're gonna target her neck, we're gonna target her TMJ together. Because like you can see that I can move my neck just by moving my face. So we'll keep them together, and we say, well, now your urination is really good, we're gonna go to your neck and face, right? And after that, maybe we go to your lower back. But lower back, as you know, she already have ringing in the ear. It might be kidney related. That might need herbal medicine, and that may be an ongoing. We don't know how much we can help with her jing, right? To
That makes,
just be honest, and they'll accept that.
yeah, that's great.
Is it
Um,
possible to attend the conference? I believe so.
no, no, there's no
Oh
virtual.
no.
We shifted the conference from Yosan in Los Angeles to San Diego, and it was not financially feasible to do it. The conference will be recorded professionally and eventually available for sale on Net of Knowledge or Lhasa OMS if you're in the US, but we are not able to accommodate any live stream.
Okay, okay.
Yeah,
But can
unfortunately.
they buy the video after?
Once it gets up online, it would take at least 3 months, but
Yeah,
yeah,
yeah.
that is possible that we will have that available once we get all the recordings uploaded and such. Let's see, use.
I so
Is your
I
patient back?
show I show Shoba. I'm usually don't do a lot of herbal medicine. I do carry them with me just for cases like this patient. She also have hernia, right? Or hemorrhoid, right? So I would give like I keep an hand on Bujong, Ichitang, Suwu Tong, but just very or any kidney formula or heart and kidney disharmony or Gui Pitang for sleep. So I keep very minimum number of herbs that I think as a person, even if we don't have any condition, we could use them and just, if you don't do herbal medicine, it's not a problem when it comes to pelvic floor. Yeah. In fact, I have a rule that I don't actually offer herbal medicine at all because, you know, because think about it, if I give you a bottle of herb and you feel better, and I give you 2 needles and you like, which one is more magical? Like for patient, right? Less medication because they come to us. They already come to a place that offer them medication, supplement, and here we are, give them more herbal medicine. And I, I I do take them, but I don't. I want to practice acupuncture. I want to see what works and what doesn't work. And that's the only way we can get better and start kind of like ability to believe in our medicine, right? Give us a chance to have something not work. And I'm like, okay, what else out there? Because if we keep like herbal medicine works so well and we keep keeping herb, we'll never get better as an acupuncturist. Um, and we go into herbalists, and I do refer them to herbalists if I think that's what they need. Okay. Um,
Are we going to
okay,
do a demo? We got 10
yeah.
minutes.
Okay,
Okay.
let's do a demo. Okay. Hold on a second. Let me so now do you see me in my background?
Yes.
Okay, very good. I'm gonna just you don't have to actually. I'm gonna take off your pants and you cover up right here. I We just set Karen up on the bed right now. And we're gonna see here and cover the pin. Yeah, yeah. All right, gonna lay your head here. So we're in the treatment room right now. Okay, gonna lay down. Put this under your knees. Right. Okay, here we go. I probably need to do it to the other side. Yeah. Karen, is that okay?
Yeah,
That's
yeah.
okay. How is your urination recently?
Recently, it's coming back, so I have
Yeah,
to.
it's coming back. What was the last time that I see you? It's like 3 months ago, 4 months
Yeah,
ago.
3, 4 months
So
ago.
so far, Karen have never received a full treatment with me.
Yes.
Every treatment is like 1 to 2 minutes.
Right,
That's
correct,
pretty
yes.
much it. Where were you when we started? 4 months ago, 5 months ago. 5 months ago, right?
Yes.
Well, how often do you wake up to
Oh my
pee?
God, like 4 times.
So Karen used to, if you can hear, Karen used to wake up 4 times a night. And the treatment with me, I pretty much just did one muscle, the adductor muscle, what I'm gonna show you soon, right?
Yes.
Just the inner thigh.
Yeah.
I pretty much just do one muscle, and after that, you didn't pee at all.
Right, correct, yes.
Yeah, that's it. Just one. And I did some needle up here for
Yeah,
relaxation.
yeah, relaxation, yeah.
Relaxation. So I tell patients that relaxation, the nervous system, but to be honest, that is what keep the result lasting for patient, right? How old are you, Karen?
46.
Karen is 46. Okay. Is it okay if I
Yeah,
lower the
that's fine.
towel? So I'm gonna lift the belly up. Can everyone see? I'm gonna bring this closer. So I'm gonna show some bony landmark right here, some belly button here, and this is the ribs, low ribs here, right? So when I come in, is it okay?
Yeah, that's fine.
I'm gonna jack here to see any tension and pressure. Like you can see that when I'm able to go up and down very easily, feel nothing at all,
Yeah.
right? And this
Yeah,
painful.
yes,
That is,
yeah.
it's like what does it feel like? It feel like you coming up and down like nothing at all, and suddenly you hit something and it feel like a hammock. Like it's like there's still a little flesh, there's still a little skin and adipose tissue, but then it's like, they're
Yeah.
right there.
Yes.
Right there.
It,
Yeah. She said, I found it.
Yeah.
So that's how we let the patient know that it's not in the head, that not just a K for Lexapro. It doesn't mean our patient doesn't need, something for anxiety. It doesn't mean that, but it just means we can help more, right? So right here, so
Yes.
I'm always check out for the rectus abdominis, which is, remember our stomach 25? The stomach, actually spleen 15, right? That is the edge. Spleen 15 is the edge of the rectus abdominis. So spleen 15 is fine. I'm jumping out now. Let me go to right there. Stomach 25. She said, yeah. So this gonna help not only with urination, it's gonna help with her digestion and bloating, correct, right? Yes. And I know we've been taught where the stomach 25 is, but when it comes into a real patient, kind of like find the halfway from the edge of the belly button to the spleen 15. This is stomach 25, but maybe move around a little bit. Like this, right, that is the better, right? It's like a millimeter different, but every one muscle is different. We can't just say halfway, right? So this is the better point for her when we find a point for stomach 25. Okay. Just want to zoom in. Okay, so we find the point. Now we're gonna go in and I'm gonna show you the iliacus real quick, right? Gonna come down from the low ribs here. You're gonna hit the bone, and that is the pelvis bone right there, right? Yes. Now we come in, so that is your iliacus. Can you see okay? That?
Yes. Yeah,
Yeah,
we
very
can.
good. So I'm actually gonna sit like this. I'm gonna sit where around her armpit is as I'm coming down, and I never jump straight down to the lower abdomen. I'm always start first. Oh, here is your rib. I'm gonna travel down. So I talk as I'm doing work for the patient, so they know what to expect, right? Load it down. Now I'm hitting the pelvic bone. I'm gonna travel. I'm gonna apply some pressure here. Did that feel good? So I'm apply very gentle. I'm pretty much just sink my hand in right here. Yeah. So I'm pretty cupping on the bone right here, and I'm moving the bone toward me, and I'm kind of sit and I'm pulling myself out. I'm pretty much like if you do rock climbing, pretty much you find a handhold and you going toward you. Like I'm straight arm Not a lot of work on my part. I'm just relaxing in, move in circle, get into this area. If the patient is have a lot of reflex, like it's like, oh, it's painful, you can give them two pillow under the knee, so they're more slack into this area. But this feel good, right? Hand on, just the whole hand, no finger poking. The whole edge of the palm right here. Feel good, right? Just relax,
Yes.
deep breath, and exhale. As she exhale, I'm coming in. Inhale in, exhale it out. So that is the iliacus. And when the iliacus relax, the opposite side is better to do the psoas. Okay. So her iliacus in here, I'm gonna use my hand and I'm scoop the whole thing under, right? From here, that is your psoas muscle right there. You're gonna find that ropey right here. Yeah, it's a pretty ropey there. Yeah. You just gotta move in circle, relax. That's pretty good. Yeah. And now, how is it feel? Left and right.
More relaxed.
More relaxed. So
Yes.
very quick. It take like 10 seconds on each side, right? This side, right? Okay. All right. And how you gonna find the rent too? Is that okay if
Yeah,
I
that's
lower?
fine, yeah.
So always ask permission, even though she already gave me permission before. Every new area I come to permission again. So I'm gonna go toward your
Okay.
pubic bone. So that
Yeah,
is
yeah.
your pubic bone right here. That's her pubic bone. To make sure you can see that pubic bones here, and the pyramidalis is just over here, right? You scoop on top, pubic bone go there. So that's the pyramidalis, right? Pyramidalis is halfway from the belly button to the pubic bone, and that's the triangle coming down from stomach 28, stomach 30, stomach 28, stomach 30 to the pubic bone. That's the pyramidalis muscle. So usually I would go up high, wrap out toward the pubic bone. Okay. I can send extra pictures if anyone needed. And now the adductor. I'm gonna turn the camera a little bit so we can see the adductor. Is it okay if I lift the towel
Yeah,
up?
yeah.
So here the adductor here. So we're gonna find to the so usually the panty line right there, the inguinal ligament right there where the growing, you're gonna go in so that the inner thigh off the bone, from the bone here, travel, and then you fall off it. That whole thing is the adductor. There is many different kind of adductor, but we're not gonna differentiate which one it is. Start using your thumb. You feel that there? Yeah. I'm gonna go ahead and get a needle and I'll go in and go out so you can see that how we do them. We don't have to keep the needle there. We don't have to stay there. We don't have to do as much. I'm gonna, so I'm gonna find here. Is it better to see over here, right?
Yes, better to see on that leg.
Oh, that leg. Okay. So again, get to the bone here, going straight up, right? That is the adductor. Or another way to find it, you can find the pulse. And that the inside, that the adductor there. So for here, you feel it there and out there. So I'm gonna press down the muscle, put the needle on top, popped it. Are you okay?
Yeah, I didn't even feel nothing.
Okay, she didn't feel nothing. Good. And we go in.
Oh, yeah.
There a jump, and then that's it.
Yes.
All done. Okay.
Good.
How does it feel?
Good.
Good. She feel good, and then it just boom in and out. Not much work, and then you will come back out, and we might give you treatment for the acupuncture. So I already got the adductor, and now you can think about applying acupuncture point like REN 2, stomach 30. You can do splint 6 down there and kidney 3. How you sleep?
So.
So her sleep is so that's something we want to focus on as well. So want her sleep well, that's gonna help to improve her pelvic floor as well. Because when we sleep well, right, we have more chi, more lifting. So do 20 yin tong and mian maybe an option for her to help with her sleep. And we might have to talk to this patient why she not sleeping well, like why she not falling asleep. So that is for the future treatment. But first, you kind of get that urination out the way first. Okay. All
We have
right.
one more
Okay.
question,
Well, we'll
Lynn.
stay and relax. We can have a treatment later. Yeah. Yeah. Hi,
There was
everyone. Any questions?
there was one more question about you mentioned there was a Stanford study. Um, what was the name of the study? There was a Stanford
Uh,
study that you referenced.
oh, yeah, yeah, yeah. I, I have some reference on the slide as well. So, yes, let me go back to the slide to share, and then you're gonna have all the the reference in there. Here you go. So I have all the reference in here. The Stanford also they have the book Headache in the Pelvis. So that was urologists and PT at Stanford that work on some of the exercises, trigger points actually. A lot of them is acupuncture points that help patients with pelvic floor pain. So these are some of so I do recommend, in your clinic, like print out, you can go into the link, print out the article, and then just leave them in the waiting room. So patient like, oh, acupuncture can help with this, right? If you're not comfortable talking about yourself and what you do, but you can plant seed, especially if they already your patient. And now I make sure this is another way to look at sleep, right? Because we can just trying to fix patients sleep, but then if they have to pee, they can't sleep through the night, right? Maybe this is another option for help with sleep and help patient to recover from pain faster. So these are some of the marketing tips that I do. And these are some of the reference if you like to look at more in depth of what going on out there.
All right. Thank you.
Any other question?
That was great. Thank you so much. So interesting. I learned so many good things
What
here.
was
Oh
the
my God.
size of
Yeah,
the?
hopefully we will see you at the conference. It is really hard to, we can't give you so much of the background of like what we're doing, like why does it work. But at the conference, we can teach more what it means, why we do this point, and what is the thought behind, right? And why the patient have urinary incontinence, what are the patient postpartum patient experience and what change in the tissues and how do we prepare patient for the next pregnancy, right? So at the conference you get more information, you get like a kind of a brochure you can bring home with you, more reading, a lot more stuff like if you like. Yeah, hopefully to see some of you there.
All right. Well, thank you. Thank you so much to everyone. Oh, somebody asked, what's the size of the needle you use for the abductor?
The size of the needle I use is 0.30 and 50 millimeter. So
Okay.
that's pretty, it's not very thick actually. Yeah,
Yeah.
it's pretty
Yeah.
thin. Yeah, 0.30.
Okay.
And
Beautiful.
for the abdominal, I use the normal, 0.20 for
Okay.
abdominal. I use very small needle and very short actually, but that's why I press on the tissue to make sure we have less to go. Because the less muscle, the less we can, the more we can control where the needle go and we can feel the texture better. Yeah.
All right. All right. Well, thank you, Lynn. Thank you so much for sharing your expertise. And thank you to everyone who
Thank
attended live today. We'll send out the recording and we hope to see you at the Perinatal Acupuncture Conference in June.
thank you so much.
All right.
Yeah,
That was
thank
great.
you. Okay, bye
Bye.
everyone.
Bye.
Bye.